Hello and welcome to the Latch podcast. My name is Amber Ginn. I'm an IBCLC and mom of two, and today we are going to be talking about something extremely important. One of the things that can really contribute to breastfeeding feeling hard. A lot of moms think about breastfeeding struggles and they think about a bad latch or poor supply. But one thing a lot of moms forget to think about is how important your support system is in your ability to achieve your breastfeeding goals. When we're talking about our support system, we're not just thinking about our husband or our mother-in-law or our sister. We're thinking about our healthcare professionals that are also supporting us across that breastfeeding journey. So what do we do when we have a mother-in-law who is telling us to just give that baby some formula? What do we do when our partner questions if we really should be trying to breastfeed? Whenever breastfeeding is going hard and we have people in our corner who start to question our decisions, it can really feel like everything is unraveling. One of the best things that we can do is do a bit of a check-in with everyone on our team to make sure that they understand why we're doing what we're doing. One of my favorite things to talk about with moms prenatally is, why are your goals? It is a great ambition to want to breastfeed for a year, but digging into why you want to do that really helps you stick through it when things get hard. So if you're listening to this prenatally, chat with your partner about what your feeding goals are for your baby, why those are your feeding goals, and what your alternative plans will be if things aren't going exactly the way you want them to. A lot of partners get frustrated in the first few weeks postpartum if they see their spouse struggling, because it's really hard for them to see us having a hard time. Same thing with our mother-in-law or our sister or our mom. When people are making comments about, just give that baby a bottle, clearly he's not getting enough, he's having a hard time, you really need to rest, any of those things that the people who care about us say are coming from a place of love. Most of the time. Don't get me wrong, toxic mother-in-laws exist and they deserve to be outcast from your postpartum bubble. But when partners and family members and support people who love us and care about us and generally are someone we want to be around are giving us advice and it feels like it's hurtful, it's oftentimes because they're trying to protect us and help us. So please remember that next time your husband tells you to just pump or something like that, because typically it is well intended. Sometimes, though, we have a pediatrician or obstetrician who starts to make comments about our breastfeeding journey, and that can be really devastating. While we love our husband, we don't typically look to them for medical advice. And so when we go to see our pediatrician and they start making snide remarks about baby's weight gain, we can really start to question ourselves and if what we're doing is actually working. So let's talk about a couple of things that pediatricians can help with and a couple of things that they might not be the person to listen to necessarily about. So one thing I see a lot of times with our clients is pediatricians starting to stress about weight loss that's in 7 to 8% in the first week. Generally speaking, babies will lose some weight after they're born. We do want to see that they return to their birth weight by about 2 weeks, give or take, depending on the situation. And we don't want to see more than 10% of their birth weight loss in that first week or so. With that said, again, as every baby and situation is unique, but if you have a pediatrician who is starting to push supplementation when we are not seeing 10% or greater weight loss, we want to be really curious. We also want to think about the fact that if you're exposed to fluids during labor for a long time, sometimes babies can take on a lot of that fluid and they can lose weight. In the beginning, that's mostly from being exposed to fluids during labor. So if you have a pediatrician who is giving you a little bit of flack about baby's weight gain, we do want to make sure that we're checking in with someone who is an expert in breastfeeding so that you can cross-reference their experience with your pediatrician's recommendations and concerns and make sure that you're all on the same page. Everyone on my team at the Latch Link is really educated on dealing with pediatricians when they're not always giving the best advice, because it can come from the angle of baby not gaining enough weight, or it can come when a mom goes to talk to their pediatrician about how painful breastfeeding is, and they're met with a bit of a dismissive attitude. Whenever a mom is dealing with breastfeeding pain and it's causing skin breakdown, bruising, babies clicking, squeaking, any of those things that point towards an oral tie, we want to make sure that the doctor that we talk to is actually educated in breastfeeding. I see this all too often. A mom goes to her pediatrician and explains that baby is clicking and squeaking when they're on the breast. She has bruising and cracked nipples, and she doesn't feel like her breasts are getting emptied after feeds. A lot of times pediatricians will tell you that that's normal. And I want to say, with big exclamation points and bright red blinking letters, pain is not something that you should deal with breastfeeding. You should not experience pain while breastfeeding. Is it normal? Yes. That's exactly why businesses like mine exist, because we support moms with breastfeeding, because breastfeeding is really hard, but it's not something that you should deal with. So if you have concerns of an oral tie and you bring that up to your pediatrician, we definitely want them to be really curious about assessing if there is in fact an oral tie. I always want to encourage moms, if we think there's an oral tie, first and foremost, talk to an IBCLC. Beyond that, if you're going to have an oral tie evaluated, we want that done by someone who actually knows what they're doing. If your pediatrician is trained in tethered oral tissue, or they happen to be an IBCLC as well, or they have any sort of training in oral ties, then they're a great resource. Beyond that, if they're not, I really encourage moms to get in with a pediatric dentist, because that's typically going to be the best person for assessing oral ties. If you are concerned about your baby's latch, if you're concerned about your baby's weight gain, if you're concerned about anything related to your baby and breastfeeding, and you bring it up to your pediatrician and you feel anything less than completely supported and feel like you got clarity, if you feel like you didn't get clarity, please speak to someone else, because you deserve to get max clarity and understanding and support and empowerment from everyone on your breastfeeding team. So let's chat a little bit about what that breastfeeding team should look like. So in reality, for most moms, it's going to look something like her partner, maybe her mom, mother-in-law, other family members. Ideally, it'll include a lactation consultant, a obstetrician who is trained in supporting moms who breastfeed, and a pediatrician who is trained in supporting breastfeeding moms and breastfed babies. So now that we've talked about pediatricians, let's get into obstetricians, because this can be another make or break situation for a lot of breastfeeding moms. I think most of you will agree with me in saying that the amount of support moms get postpartum in the US is severely lacking. Most moms go in for a 6-week checkup where they're told that they're cleared to have sex and lose weight, and that is about all. Occasionally, if you had a C-section or complicated delivery, you might get in at 2 weeks or 4 weeks, but either way, even if you saw your obstetrician 2 or 3 times across the first couple of months, that's typically not enough to really support everything that's going on as we're healing and recovering from childbirth. So if you go to your obstetrician and you share with them any concerns about your breastfeeding journey, we really want them to be educated and supportive. I've had so many moms come to us after going to their 4-week or 6-week checkup, and they are just so confused and overwhelmed because they told their doctor that they feel like their milk supply is low, and they were told, oh, no, it's probably not. It's probably fine. Or they're told, yeah, it probably is low. You should just supplement with formula. Those are really helpful situations if we're not figuring out why the issue is happening in the first place. Another thing that's really, really important when it comes to your obstetrician is making sure that they understand how breastfeeding interacts with any medications that they might recommend. We have a lot of moms come to us who were given an IUD at their 6-week checkup without considering anything in terms of how that IUD can affect breastfeeding. So when we're coming to a time when we're deciding to use birth control, we definitely want to make sure that we have someone on our team, like an IBCLC, an obstetrician, who is informed on breastfeeding and all those different things, or both, ideally. So just remember that when you're working with your obstetrician and pediatrician, sometimes the advice that they give you is going to be awesome, and sometimes it's not. And it's up to us as the boss of our bodies and babies and breastfeeding journeys to really try to suss out what feels good and what doesn't. So if you talk to your pediatrician and you leave and you're feeling overwhelmed and more confused than when you got there, definitely lean on someone who is more educated in the breastfeeding space. If you go to your obstetrician appointment and you talk to them about your hormones and how you're concerned about how those are interacting with your ability to make enough breast milk, and you leave feeling confused and overwhelmed and dismissed, again, breastfeeding expert on your team is going to make a really big difference. Not only can we help you to understand what's going on with breastfeeding and come up with a plan, we can also help you understand how to speak to those providers so that you can get what you want from them. Because we have a lot of moms who come to us and they have seen their pediatrician a handful of times about perceived oral tie, and they're not really sure how to really get that pediatrician to give them the referral that they need to go see a pediatric dentist. And so just having that support person who can help you formulate the language and to ask the right questions. Let's talk about something else that's really, really important when it comes to support. So we touched on how partners can sometimes give us advice and recommendations that can feel dismissive or problematic when we're breastfeeding. And one of those is just pump so everyone else can help feed the baby. So sometimes it's just pump and sometimes it's use some formula. So both of those we want to kind of get to and talk about how they can affect breastfeeding. So if we start pumping before we're ready, it can be really detrimental to our ability to reach our breastfeeding goals. We want to circle back to what I said in the beginning. Why are our goals? So if your goal is to feed exclusively at the breast for 12 months, then you probably don't want to be introducing formula bottles or a pump. If your goal is to feed exclusively at the breast for 6 weeks and then start pumping and using bottles, then we can be a little bit more loose in when we introduce the pump. So we don't ever want to feel like breastfeeding is confusing and overwhelming, and so now we're going to start pumping because nothing else is working. Because when we do that, we're just throwing more things in the mix. So if you're hoping to feed at the breast and it's not going well and you have to use a breast pump because you need to get milk out and you need to be able to get milk into baby, then we want to really be relying on the help of a professional who understands breastfeeding so that we can make sure that you're pumping in a way that's supportive of your goals overall. Another thing that really comes up often is partners and family members wanting to feed the baby with a bottle. So this in and of itself is kind of a touchy subject in the lactation and breastfeeding expert space, because a lot of people will be like, well, dad can bond with baby a bunch of other ways. And that's definitely true. If you're a mom who wants to have your partner or mom or older sibling feed your baby with a bottle, that is totally doable. It just needs to be done in the right way. A lot of IBCLCs say that dad can bond with baby in ways outside of feeding them with a bottle, which is totally true. So if you as the mom are not wanting dad to use the bottle and you're wanting to feed exclusively at the breast, there are a lot of other ways that your partner can bond with your baby. They can do skin to skin, they can give baby a bath, they can take baby on a walk, they can do tummy time with baby laying on their chest. There are so many things they can do to bond with their baby. But if you are a mom who is wanting to have your partner or family member feed the baby with a bottle, that's totally doable as well. I think we have a lot of IBCLCs who create content that's kind of borderline fear-mongery, where they're like, oh, once you start to introduce bottles, it's going to hell in a handbasket from there. And that's really not true. That's why understanding our why behind our goals really makes a big difference, because if your goal is ultimately to use bottles and pumps and maybe even formula down the line, then we have a lot more leniency in how we implement different feeding choices in the beginning. So if you're hoping to have your partner feed your baby with a bottle, please don't worry. You can definitely still do that and keep your supply up. The number one thing we want to think about is if baby is being fed with a bottle, we need to be removing milk from our breast. So let's say you want to let dad give baby a bottle at 7 p.m. because you want to take a bubble bath and rest or something, assuming you're cleared for bubble baths. You would have dad feed that bottle to baby, ideally of pump milk from early in the day, which is another thing, but we're just going to focus on supply. You're going to have dad give that baby that bottle at 7 p.m. and you're going to pump at 7 p.m. And then next time baby's ready to eat, your breast should be ready to go, and that's how it goes. We don't ever want to skip expressing milk. We don't ever want to give our body signals that baby needs less milk. Where we get into some dangerous territory is when we have moms who are having partners or family members feed their baby with a bottle and they're not taking the time to remove milk from their breast at that same time. So let's talk about formula use as well, because this is another hot topic in the conversation of support and when we should get help and how to interpret what our doctors are telling us. So if we are in a situation where our baby is genuinely losing a lot of weight and we are just genuinely unable to produce enough milk, utilizing formula is not the end of the world. I have so many moms across this past decade who have worked with me where they came to me or someone on my team and they were using formula and they were not feeling very good about that. And a couple of different things can happen. Working with a professional who can really help you understand why you're using formula and what you can do to get closer to your goals really helps you not feel so defeated. A lot of moms feel really defeated when they have to use formula. And at the end of the day, we do want to remember that babies have to be fed, and sometimes that we can feed them in the way that was in our plan, and sometimes we have to pivot, and that's just part of motherhood. So the sooner we can get past that obsession with perfection, the better we're going to have an experience of being a mom. So just understand, if you do end up needing to use formula for a reason, that doesn't mean that you're always going to be stuck using formula, and it also doesn't mean that if you're using formula and you're like, hey, actually I kind of like using formula and I'm going to some breast milk and some formula, that's okay too. We don't ever want moms to feel like they have to pick one thing or the other. So if you are using formula, we do want to remember, same thing as if our partner or family member is feeding baby with a bottle, we do want to continue to stimulate our breasts if our goal is to have enough milk to feed baby exclusively from the breast milk that we express. So just making sure if you are using formula, sticking to continuing to pump at regular intervals or continuing to offer baby the breast at regular intervals is going to make a big difference. Let's talk about a couple of tips for your partner to be able to feed your breastfed baby with a bottle, whether whether it's pumped milk, donor milk, or formula, in a way that's going to be very supportive to your ability to get that baby back on the breast. So when we think about feeding a breastfed baby with a bottle, there are three things that we want to keep in mind. So the first thing is positioning. So we want to make sure that when we're feeding our baby with a bottle, that we have them in a similar position to what they're in with breastfeeding. A lot of times in hospitals and with pediatricians and even a lot of other breastfeeding professionals, they're going to teach you something called paced bottle feeding. So I've got my baby here so that I can use it as a visual aid for those of you watching this on YouTube. And if you're listening to it, maybe pop over to YouTube to see this part. So when we're talking about the positioning that we feed baby in for breastfeeding, generally speaking, he lost his hat. Generally speaking, baby is rolled in towards us and they're kind of side. What happens with paced bottle feeding, which a lot of breastfeeding professionals teach, is they have baby sat upright. If that's what works for you, that's completely fine. Generally speaking, I really recommend that we feed baby in a side-lying position where baby is rolled outward, and we can feed them with the bottle that way. When we do that, that helps baby stay used to a position that they're in when they're breastfeeding, and it just seems to be a little bit more conducive to swapping back and forth from the breast to the bottle. So the second thing we're going to talk about is something that I feel like a lot of parents don't know about at all, which is responsive bottle feeding. The position that you feed baby in is really, like I said, if pace feeding positioning works well for you, that's great. I do find that sideline positioning for babies who are fed at the breast primarily and are going between bottle and breast is typically best. But when it comes to introducing the bottle, regardless of position, we do want to use responsive bottle feeding. What is responsive bottle feeding? So essentially, the way most people feed a baby is they pop that nipple right in their mouth and they start the flow of milk, and that's that. With pace feeding, we do a little bit of this up and down that's not really based on a whole lot of science. If you ever really dig into the science and evidence of pace bottle feeding, it's kind of something that people started doing, and it was never really disproven, but it wasn't ever really proven to be super effective. That's neither here nor there. So while with pace feeding, we do some up and down, with responsive bottle feeding, what we're trying to do is get baby as close to experiencing what they'll experience on the breast on the bottle. So when we latch baby to our breast, typically they have to latch and suckle for at least a few seconds before the flow of milk starts. So with responsive bottle feeding, that's what we're mimicking. We're going to have baby in our position here. We're going to introduce the bottle into their mouth, and we're going to keep it in a way where the milk is not flowing yet. So we're going to have them a nice deep latch on the bottle, and we're going to have them suckling, and we're going to wait. If your baby's used to nursing and bottle feeding and they're used to just bottle just popping in and milk starting to flow, they might get a little bit mad if you go longer than 5 or so seconds. But if you're just starting out, my favorite thing to do is to let them suckle for about 15 seconds before we start the flow of milk. I have a lot of parents ask me, what about swallowing air, so on and so forth. Generally speaking, babies aren't going to be swallowing if there's nothing there, so they're going to suckle much like they would on a pacifier, so you don't really need to worry about it very much. So you're going to introduce that nipple into their mouth, let them suckle for 10 or 15 seconds, and then you're going to start the flow of milk. So doing that really helps baby do well going between breast and bottle. The third thing that we want to keep in mind when it comes to swapping between breastfeeding and bottle feeding and how we can best support our breastfed baby with using a bottle is the type and shape of nipple. If you're a breastfeeding mom, you have most likely heard of the triangle test for nipples. So the triangle test is pretty straightforward. You literally are going to make a triangle with your fingers, and we want the shape of the nipple to be within that triangle. It is very wide. It would not pass the triangle test because the base is really going to be outside of the base of the triangle. So the real issue with why we want to use a nipple that passes the triangle test and looks more like this versus one that's really wide is we're always wanting to encourage baby to get a nice deep latch, whether that is at the breast or on the bottle. And when we have a nipple that's really wide at the base, generally babies can't get really far on, so they end up kind of just suckling to the tip, and we do not want them doing that with our boobs. So when we have a nipple that passes the triangle test, they're able to get a really deep latch, just like we want them to have when they're on our boob. So beyond the shape of the nipple, we really want to talk about the flow rate. For most babies, most of the time, we want to use the slowest flow nipple that comes with the particular brand of bottle that we're using. And we do want to keep in mind that every single nipple and bottle manufacturer in the US is going to have different standards when it comes to testing. So we do want to always check and make sure that our nipples are flowing properly. I had a mom one time who got a 3-pack of nipples, and she was using them interchangeably, and all of a sudden baby was just having a really hard time on the bottle and was not drinking hardly anything. And so we checked the flow rate. We literally had mom just like on the bottle, and it was like nothing was coming out. So So please remember that quality control wise, we do always want to do our due diligence there, checking in. But generally speaking, for most babies, we do want to stay with that slowest flow rate. If you're working with an IBCLC or someone in that infant feeding space, there are instances where we do want to use a faster flow. But generally speaking, we do want to start with a nipple that passes that triangle test, and it is the slowest flow rate. With all of this information that I've shared with you, I hope you can realize how having someone on your team who understands breastfeeding and really understands how to support your breastfeeding goals can make a massive difference in your outcomes for breastfeeding and for your experience and level of enjoyment of nursing your baby. It's so important that when we're making decisions and when we're dealing with struggles, that the people in our corner are there to support and encourage us. All of this information that I laid out here has been something that we see moms struggle with time and time again, and had just had that support person in their corner originally, they could have avoided so much struggle. So if you're a breastfeeding mom and you're feeling like you're having a hard time with anything we talked about or with anything related to breastfeeding at all, please remember we are here. The Latch link offers insurance covered care to moms all across the US, provided virtually, and we oftentimes have same-day appointments available. You don't have to struggle alone. Breastfeeding is meant to be enjoyed, so please reach out to us if you're having a hard time.